Welcome back to the Oral Health Podcast. Now, off the back of our conversation with Ben yesterday about those in hard-to-reach areas, I've brought in Farah Saleem, who is a dental nurse and is very proactive in her community with supporting those who currently can't access an NHS dentist. We had an absolutely brilliant conversation, and stay tuned to learn all about her latest community event. Okay, so Farah, for anyone that doesn't know who you are, do you want to just quickly introduce yourself and give us a little bit of background into you?
Yeah, so my name's Farah Saleem. I'm a dental nurse and a dental tutor. I'm currently working in Manchester at a practice called Stonmount Dental Practice. I do nursing. That's my main job because I absolutely love it. So I think I'll always continue doing dental nursing. A little bit of a background about me is I started off as a receptionist, not thinking about going into dentistry at all. I was actually helping out a family friend at a practice and covered the reception desk one day. And then she allowed me to get a job at a practice that she was working at as a receptionist. So I started off as a receptionist and I was happy at the time. Just do reception, I was in control of it and I knew what to do, and the job was good. I was in a happy place, and my employer approached me and said, "Do you not want to do your dental nursing?" And I was like, "No, not really. I'm happy on reception." He was like, "Can you see yourself doing reception forever?" And I was like, "Yeah, I think I can at the time." But I'm so glad now that he put me on the National Diploma in Dental Nursing. And I qualified as a dental nurse because since then I've learned so much and come such a way. So still dental nursing, had a chance to do, senior practice management at practices, gone on to do some local nursing around Greater Manchester, also travelling to Jersey to dental nurse, which was an experience in itself. So that was pretty amazing. And then wanted to, because I was so loved dental nursing, I wanted to start teaching, other people to come into dental nursing. So decided to open up my own dental nursing academy and got accredited by the NEBDN and started my academy. So that's the little bit of background about me. So just really passionate in dental nursing. I just want to get that out there and helping patients. I suppose you get into all of that when you're in the career and you have the passion for looking after people.
Yeah, I can tell from talking to you, your passion really comes across, and just seeing you talk about it, I can feel it. It's lovely to see. Wait, do you work in practice now then? Do you see just NHS patients or just private patients, or is it generally a bit of a mix?
We are more NHS patient based. We do see private patients as well, but mainly I would say it's an NHS practice.
Mm-hmm. So I think then a good thing to get your input on would be, for lack of a better term, the elephant in the room in dentistry at the moment, which is the NHS system for dental patients. And I really want to hear from your side, as someone that sees patients all the time, what the impact of the current situation has been on the patients you see.
I think it's been there for a long time, even pre-COVID, if I'm absolutely honest with you. I know the pandemic was a setback for all of us, especially in dentistry, and I can only speak on dentistry in regards to that. But having the pandemic come and then seeing how much of an effect that has had on NHS dentistry is really saddening. I think from a dental nurse's perspective, being in a practice and seeing it, just really difficult to see patients who are struggling in this current climate to get basic NHS dental care. And we can't always blame patients and we can't always blame everything else. And I think it's due down to the NHS contracts and the government. I think that's where I don't want to say blame, because, collectively we're in it together and we should be helping each other. But we can only do so much. So if the contracts from the government were better, then I suppose NHS dentistry would be better. But seeing people who are not registered with NHS dental practices currently, the volume of phone calls that we get on a daily basis now is quite heartbreaking, because we can't give them any spaces, we can't see them, you know. There's been schemes set by the government and things like that. Although it has helped partly, I don't think it's helped enough. So yeah, it's a little bit heartbreaking to see that at the moment. And we're working more and harder each time to see patients as well. There's just a lack of, I don't even know what the word is to use, to be honest with you.
Yeah.
Is it no compassion from the government? What is it? We don't know. I don't really know what to say on that.
Yeah, no, and it is a difficult topic to discuss, and but I appreciate how frank you've been around, you know, you, and at the end of the day, you and your team are the ones that have to tell those people, we can't help you. And it's very unfair that you're being put in that position. And unfortunately, that's just the cards that were dealt. But one of the things that I think is so great about what you do, and we'll talk about this in a second, is you have took it upon yourself to set up community events and help get oral health care out to the people that really need it, but unfortunately can't access it. So can we just have a little bit of a chat about that? Because I think that's a story that we really need to share and get more people on that train.
Yeah, of course. So the reason I decided to do a community event is, one, coming from dental nurse background, we have so many things that we want to do as dental nurses. I'm not always able to do because we don't have the opportunities. I'm lucky in the sense I've had the opportunity. I've got my academy, and I can work from that perspective on helping in certain situations and doing certain things. So as bad as it is right now for people not being able to access NHS dental care, I thought it'd be a good idea from the academy, from eye care dental nurses, that we started something community-led. So we got together as a team and we decided, just in our local community in Manchester, that we would have a oral health event which allowed us to give people in the community basic oral health advice to help with, I suppose, preventative dentistry. So if we could prevent from the beginning, it wouldn't be such a toll on the NHS dentists that we have currently. So if we're providing that oral health advice in the community, then that would prevent it. So just simple things like getting dentists on board on the oral health day, allowing people of the community to come in and ask the questions that we find that patients don't know about, brushing twice a day, and when to floss and how to floss, and, you know, spitting out toothpaste and just leaving it in for the fluoride, you know, just the small basic things I think that a lot of the community needs to hear from. So we can do that by setting up these events because we're able to, we're professionals, so we should do that. And also, you know, as reaching out to, I suppose, companies that can help with sending out some toothbrushes that we can hand out to people in the community, especially children who don't have access to that, sitting with them. So we're going to do things like having little children workshops on the day. So children can have use practicals and tablets, and we can say, oh, look, you know, you've missed there. Get this toothbrush and let's brush the gums and spit out into a cup, and you can see where you've missed. And just having that little bit of, I suppose, workshops in the community will help people to maybe not need NHS. I wouldn't even say NHS, just dental treatment, because we've provided that oral health advice from the beginning. So I do want to, I mean, this will probably be my first event, but I do want to continue these community events in different communities, so we're able to help everybody and not just our community. I think I just wanted to start in our community because this is where I live, and my faith tells me to start charity in your community. So I just wanted to start this here where we are. But yeah, of course, reaching out to other communities and giving people the chance to look into oral health advice and help them, because we can do that. Of course, we can do it.
Yeah, it's just lovely to hear that there are people out there who want to be proactive and are seeing the hardships that people are going through and knowing that, oh, if I can step in and prevent these things from happening. Because we were talking about the similar subject with our past president Ben when we had him on the podcast, and saying that, you know, a lot of oral disease is preventable, and if we can step in and help from that point, then that sets you up for success for a really long time. And actually,
absolutely, yeah.
And that advice is quite simple to give as well. It's just having the resources to do it.
Yeah, it honestly does. There is oral health advice out there. I just don't think there's enough, even in the education system in schools. I just don't feel, and I see that because as a dental nurse, when we're seeing patients on a daily basis, after all these years of being a dental nurse, 13 years of being a dental nurse, still seeing that people still don't know the basic oral health advice. And where would they know that from? So it should come from like in schools, and it should come from local communities, and there should be advice in I suppose GPs on you know, flyers. It shouldn't just come from being at a dentist and going to a dentist and the dentist telling you your basic oral health advice, because right now the access is not there. So this advice should come from other places too. So the education in oral health should be more, I feel, so everybody knows it, so we can prevent.
Yeah. Now, if there's any, because we do have quite a few dental people that listen to our podcast, if there's anyone listening that is thinking, oh, that sounds really like a good idea, I think I should try and do something like that for my local community or my area, what would your advice be to them? And because you've been through the setting up the event and the logistics side of it, and
the advice I would just give is, if you can do it and you have the means to help your community, reach out to sponsors that can help you, then by all means do it. It's not about, I can't afford to get this and get this, because there are people out there that are willing to help. There are businesses out there that will sponsor and will put into these community events to help communities, because it's only when we all get together that these things can happen. I suppose from an event organizer perspective is just if your passion is to look after patients and look after people, especially in dentistry and oral health, then just put these community events together. Even if it's small, even if it's just your local office, and you're doing a day where people are coming in and you're giving them oral health advice, just do it, because in the overall perspective of things, we're there to help with oral health, and that's what we're meant to do. So just go for it, and don't worry. And if you need any of the support, you can always reach out to me, and I can give that support to you guys. But yeah, it's been I'm not going to say it's been easy. It has been hard, but I think because the passion was there to help, you just push on.
And so if anyone just want to reach out to you, where can they find you?
So they can email us at info@icaredentalnurses.co.uk, and I'll get back to you as soon as I can and let you know. And if anybody wants to get involved in this community event on the 25th of June, then they're more than welcome to. They can just send us an email and we can get anybody who wants to be on board with this.
That sounds great. And I tell you what, I'll put all the information that you've sent me about the event as well in the description of the podcast, and we'll share it. So if anyone sees that, then they can always get in touch as well. Yeah. The more the merrier, I think, with stuff like this.
The more the merrier, yeah. I think we have to do something now. As much as we want, I suppose, if we do begin these community events, maybe the government will see this, that like, you know, people are helping out themselves and they've had to do these things to help the community. Maybe we should help a little bit more. That's what I'm hoping for.
Yeah.
But let's see.
Yeah, big picture, then
Yeah,
maybe,
of
you know,
course.
down the line.
Yeah, of course.
Well, I tell you what, I think that's a good place to end. Thank you again, Farah, for sitting and talking to me. And good luck for your event as well. I know I'll speak to you before then, but I can't wait to hear all about it.
Thank you so much. Thank you so much for having me on here. It's not only giving me a voice as a dental nurse, but just somebody generally in dentistry who wants to help people with their oral health. So it's given us all a voice, I suppose.
There we are, that was Farah there sharing exactly what it is like to be a dental nurse and really being a champion for her profession. Now, if you want to learn more about her and her organisation, just go to I Care Dental Nurses. All of their information, like I said, will be in the description of this podcast, as well as all the information about her event. So if you are free and you want to go and help out, I'm sure she'd be really happy with that. Just let her know, and all of her information, like I say, will be below. Now, if you'd like some more bespoke oral health advice, then you can go to www.dentalhealth.org and look at our helpline. You can also go to smilemonth.org to learn more about National Smile Month, or follow us on social media. Thank you once again for listening, and thank you to Farah for joining me.